I'll cut that out of the video. Super professional here at the border.
Hi laser lovers! I've been getting a lot of questions on pre and post care. So in today's video, I wanted to share all the instructions I give to my clients so you're prepared if you're planning to embark on this laser hair removal journey. The rules are the same no matter what area you're treating. So here's some pre-care. Your provider might ask you to stop topical medications or certain skincare products 3 to 5 days prior to treatment, depending on what you're currently using. Certain medications might be longer, such as Accutane. You typically can't laser for about 6 months post using Accutane. Some other acne medications might require a little longer lead time as well, sometimes about 2 weeks. You have to avoid bleaching, tweezing, or waxing the hair for about 4 to 6 weeks prior to your first treatment. The hair must be present in the follicle in order for the laser to catch and destroy it. I know you think your hair that you tweeze is growing back right away, but it's not. That's another hair. If you don't tweeze for a whole month, it's not the shaving that makes you grow more hair. You just have more hair than you knew you had. Avoid the sun 2 weeks before and after every treatment. Recently, tan skin cannot be treated, but tan skin in general is not recommended. If you hold a tan, it is important to share that with your provider, and a decision can be made with how to better treat you. Treating over an older tan poses more risks, may be more painful, and usually causes a need for more treatments overall. Artificial tans should also be avoided 2 weeks prior to treatment. If you have remnants of any sunless tanner, your treatment usually will have to be canceled. The skin needs to be clean shaven on the day of the treatment. It's important to shave against the hair to have the smoothest shave possible. The smoother the skin, the better the treatment is, the less risk for any potential side effects. And although the lasers have a cooling mechanism, the use of a topical anesthetic is sometimes an option if you're more sensitive, and it's usually only used in smaller areas. So here's some post-treatment for you. Redness, itching, and swelling in the area is normal and is actually the sign of a good treatment. If you don't have visible irritation, don't be worried. That doesn't necessarily mean that you didn't have a good treatment. That just might be your own skin. The irritation typically only lasts a few hours, but can last 2 to 3 days. Hydrocortisone can be applied for 2 times a day for a few days to help alleviate redness and itching. Avoid exercising, hot showers, saunas, steam rooms, or really extreme heat of any kind for 24 hours. Or if your irritation lasts longer, keep avoiding those things until all sign of any irritation has resolved. Avoid sun exposure for at least 2 weeks post-treatment and be sure to apply SPF daily. The hair will appear to continue to grow from the follicle for about 2 weeks post-treatment. It may even feel coarser and more stubborn.
And then is there a time where it's too long where you don't get as good results?
Yeah, like more in the beginning of the treatments, if you wait too long, it's not gonna hurt you, it's just you end up needing more treatments in the long run.
Oh really?
Yeah, just because you're kind of giving it a chance to get strong in between.
Oh, okay.
That's what I've seen,
Yeah.
Then it's kind of like you're starting over
Yeah.
the first few times if you wait 3 months in between,
Right.
But I feel like once you've done 4 or 5 sessions, it's not as big of a deal if you wait longer.
Okay.
The only time I'll do 4 is for the face, because the face tends to grow faster. But what I have noticed is that on darker skin, the 4 weeks is too short for some reason. I don't know if the hair just seems to grow slower on darker skin types, but I feel like the 4 weeks is always too short for dark skin. So I usually do 6 weeks regardless, even on the face.
Okay.
The hair will naturally shed, and it can take up to 21 days post-treatment to shed. After the shedding, you will typically have little to no hair growth until right before your second treatment. Shaving is really the only appropriate hair removal method between treatments. You can shave as often or as little as you'd like. It really doesn't affect the treatment at all. You just have to be sure to remember to shave the day of each laser hair removal appointment. I hope that if you've decided to embark on this very exciting journey, you'll share your thoughts and your treatments with me, because I love hearing what everyone has to say about laser hair removal, and let me know where you're from and where you're getting it done. Feel okay? Mm-hmm.
Thanks for watching. Make sure to like and subscribe if you enjoyed this video, and follow us on Instagram at @ParlorMiami for daily updates.